Welcome to this training video for Poole Hospital medical and non-medical staff working in the critical care unit during the COVID-19 pandemic. The aim of this video is to explain how the Aisys CS2 anaesthetic machine works and how we intend to use it as an intensive care ventilator. We describe the similarities and differences between the Aisys CS2 and dedicated intensive care ventilators, its components, how it is set for ICU use, how to start and stop ventilation, and how to deal with some problems. Anaesthetic machines are designed to provide anesthesia and intraoperative positive pressure ventilation. The Aisys CS2 has a capable ventilator that is equipped with sophisticated software and a variety of modes. However, it was not designed with the delivery of prolonged and continuous ventilation in ICU in mind. The manufacturer GE has therefore declared this off-label use and published some written guidance. The setup described in this video is intended for use in Poole Hospital only and may be subject to change. There are many similarities between the Aisys CS2 anaesthetic machine and intensive care ventilators. Both are connected to mains compressed gases at 4 bar. They have inspiratory and expiratory ports, a touch screen, and a ventilator with a variety of modes. However, there are also some very important differences. The Aisys CS2 has a circle system like most anaesthetic machines, and we will explain this in more detail later. There is a bag for manual ventilation, a ventilator with bellows, and a selector that allows us to switch between manual and automatic ventilation. There is no automatic leak compensation, which is important in modes such as non-invasive CPAP, although this should not be a problem as we will be using high flows. The anaesthetic machine's own gas sampling must be used, otherwise a constant alarm will sound. The display arrangement is slightly different compared to an intensive care ventilator. The Aisys CS2 was designed for continuous monitoring by a healthcare professional. Therefore, the alarms and the volume of the audio alerts are lower and softer than in most ICU ventilators. The machine has a battery, but it was not designed to function whilst on the move. The machine was designed to be turned off and on and checked every day. Clearly, in intensive care use, this is not practicable as the machine would be out of action for up to 15 minutes and the patient would require alternative means of ventilation. We feel that turning the machine off and on and performing a full check once every 7 days is a safe compromise. Another important aspect of this anaesthetic machine is that in case of a device malfunction or a system error in the electronics, it will not continue to ventilate. An alternative ventilation device must always be immediately available. The Aisys CS2 has some additional features such as an auxiliary common gas outlet, which should not be used in intensive care. This is the end of part 1. Please watch part 2 for setup and components.